If I look or sound a little bit tired in this video, that's because I am. The past month or so has been a whirlwind of appointments and testing, and I have finally gotten some answers and some more questions about my chronic symptoms and pain. Hey y'all, it's Morgan, and I am back with a really big health update. Over the last several months, I have seen 5 specialists, and I want to share with you the details of what's gone down. But as always, this is my personal experience on my chronic illness journey and not medical advice. So, talk to your doctor, do your own research and all that jazz. Just in case there's anybody new here, I will give a brief background about what's been going on. But if you want to know more in depth about my chronic illness journey, I've got several videos from the past 3 years, mostly in my Life with Chronic Pain playlist and my hysterectomy playlist, so you might want to check those out. But basically, a few years ago, I was really sick, like throwing up, couldn't eat, severe pain, like withering away and like a shell of a human, like really not good. And I was really sick in that horrible condition for like 2 or 3 years-ish. I don't know, it's kind of a blur now. But then about 2.5 years ago, I had my hysterectomy and I had pelvic adhesions removed, which greatly increased my quality of life. But I never got like completely better, and I still had some pain and some symptoms that were just not as severe as before, but definitely still impacting my day-to-day life. And now, 2.5 years since my hysterectomy and like, I don't know, 5-ish years since the onset of my like serious symptoms, I'm finally figuring out this chronic illness puzzle. Before I get into the specialists, let me quickly summarize the symptoms that I'm still having. And they vary in frequency and severity, but here they are. So there is high heart rate with just like normal activity, and I have GI issues and periods of low appetite and nausea and sometimes vomiting, which is not as often as it used to be. I used to vomit multiple times a day, every day, when I was at my peak sickness. So like, it's much rarer now, but still occurs. And fatigue. I take a nap like just about every day. Like I just get so tired where I'm like, I literally can't do anything else until I nap. And brain fog and the chronic pain in my low back and hips. Okay, so now I'm ready to talk about the specialists, but I'm going to talk about 2 that I saw a while ago that I touched on in some older videos, and these ones don't count towards the 5 recent ones, but I'm going to go ahead and talk about them a little bit to paint a fuller picture of how I got to where I'm at now. So about a year after my hysterectomy, my primary care did blood work and found a positive ANA, which stands for anti-nuclear antibodies, which can indicate something autoimmune going on. So she sent me to a rheumatologist, and I thought, yay, I'm about to find out answers. But she just did an MRI on my SI joints and lower back and didn't do any more blood work. And the MRI came back normal, and then she was like, okay, come back in a year or when you develop classic autoimmune symptoms. And I was like, okay, but like I kind of have some symptoms now. There's nothing more you're gonna look into, but that was pretty much it for her investigation. And then maybe like a year after that, I was finally like, okay, I really need to see somebody about this pain and issues that I'm having. So I was like, maybe a pain specialist is where I need to go, since the rheumatologist didn't seem to be the right place. Like maybe the pain person will have more experience with this. So went to a pain specialist, and they were with me for like less than 10 minutes. They kept interrupting me while I kept giving background. And I specifically said that I had an MRI, that they were looking for like arthritis in my low back SI joints, and it came back clear. Yeah, then she didn't offer any kind of diagnostics. She was just like, yeah, I can do injections. And I was like, I don't want injections. That's not why I'm here. I was kind of hoping that you could help me figure out what's going on. So that wasn't the best appointment ever. Because then after that I felt pretty hopeless. I was like, okay, if it wasn't the rheumatologist and not the pain specialist, then who am I supposed to see about, I don't know, the pain and the issues that I'm having? And then after that appointment, when I looked into the notes for it, the doctor put injections to help treat arthritis, when I specifically was like, I've been tested, I don't have arthritis. So that was a little annoying. And then the cherry on top of all of that appointment was they made me do a drug test, or like sort of, so like to, I guess, get certain injections and pain medications, you need to do a drug test, which, okay, yeah, but I told them I'm not there to get medication right now. I'm trying to look for the problem. But the intake nurse was like, it's routine, just, sign the form and do the P, like, it's just routine, it's what we do. And I was like, okay, fine, whatever. I had my objections and whatever, but if it's just routine, whatever, fine. Well, it turns out insurance didn't cover that, so I paid $250 for that stupid drug test. So that was just like a real, kick in the nuts, so to say. Okay, so now that we got those appointments out of the way, let's get to the 5 specialists that actually led me to somewhere. Starting with a cardiologist that I saw in September of 2024. And she did a workup including an echocardiogram, a treadmill stress test, and a 72-hour Holter monitor, which is the heart monitor that's got electrodes on you that you wear all day, every day, unless you're showering. In my case, for 72 hours. And all of that came back normal, and she kind of expected it to, because based on my symptoms, she said it sounded like I had POTS, and with that, it's normal for those tests to come back normal. But she did not have the expertise or equipment to diagnose me with that, so she referred me to Johns Hopkins POTS Clinic, and we called shortly after visiting, so in September 2024, we called to schedule an appointment, and they were currently waitlisted for approximately January of 2026, over a year. So I got on the wait list. And in the meantime, the cardiologist wanted me to get a neurology workup to see, because POTS falls under dysautonomia, which is autonomic nervous system dysfunction, and neurologists, that kind of seems like it would be in their alley. So she didn't have anyone in particular that she said to go to, so I researched neurologists in the area and tried to find somebody that had POTS or dysautonomia in their biography, or just like related somehow, but I couldn't find that, so I just found somebody that had good reviews, and I went to a neurologist, which was a very short appointment. I had like a stack of papers, previous blood work, imaging, all of that. Walk in, start to say symptoms, and the doctor goes, sounds like you have POTS. I don't do POTS. And I was like, okay, do you do any kind of dysautonomia? And she said, nope. And I was like, does anybody in this practice do dysautonomia? And she said, nope. And I was like, okay. Then it was kind of awkward for a second, and then she called somebody and was like, hey, don't you know that POTS specialist? Do you have his information? And that is how I found the POTS specialist I ended up going to much sooner than January 2026. But we will talk about that specialist in a little bit. And then next, I saw a different rheumatologist, because the whole autoimmune side of things needed to be evaluated and ruled out or confirmed, or it needed something. It was still kind of all up in the air. So I saw a different rheumatologist that had really good reviews about, being investigative and really looking for the problem. And she ran a bunch of blood work for autoimmune conditions, and it mostly came back normal, except for the positive ANA. And so far, still none of those classical autoimmune symptoms. But the doctor did say that a positive ANA sometimes does show up years before the onset of an autoimmune disease. So I will keep going back to her every so often to keep tabs on that and check, because it's better to catch that stuff early. And she did give me meloxicam, which is a pain medication, to try. And I took it for like 3 weeks, and I didn't really notice a difference in my pain. But I did like her a lot, and I was very happy that she, did all the blood work and ruled stuff out, and that she plans to stay on top of it. So I feel comfortable continuing with her in the future. And then I saw a GI specialist, and she did an endoscopy where she looked in my stomach and she took some biopsies from in there, and everything looked normal except for some mild inflammation. And next she wants to do a stomach emptying test, which measures like how fast food leaves your stomach and moves through your digestive system, looking for gastroparesis, because the problem that I have had in the past is like throwing up food like well past the hours where it should still be in my stomach, which again is not as common as it used to be. So I'm gonna hold off on that for now because this next specialist has kept me really busy. So let's move on to the POTS dysautonomia specialist. Now I saw the specialist in January, like a whole year earlier than the other place was supposed to. Although this place is still affiliated with Johns Hopkins. Somehow they got merged in or something at some point a long time ago. I don't know. Anyways, but it's separate from the Johns Hopkins POTS clinic. And this specialist happens to be a pediatric cardiologist. So it's possible I've found them in my searches before and was like, oh, they treat kids. I'm not a kid. But they treat people up to like 50 or 55 years old. So if you see somebody that treats POTS dysautonomia, but it says pediatric, give them a call and see if they treat people your age, because they might. And there's not that many dysautonomia specialists in the entire country, so yeah. Anyways, this is where I actually started to get some answers. So on my first visit, they did a flow cytometry blood draw, a echocardiogram, and a tilt table test, which is where they strap you to a table and they measure your heart rate, blood pressure, and CO2 output, and they have you lay flat for so many minutes, and then they stand you up for so many minutes, and they lay you back down and measure the changes. So after those tests, I saw the doctor that same day, and she told me that I had POTS, which stands for postural orthostatic tachycardia syndrome, which basically means your heart rate is high when standing. During the test, my heart rate increased 44 beats per minute, and an increase of more than 30 is indicative of POTS. And then she also evaluated me for Ehlers Danlos syndrome by, there's certain criteria to meet, but like there's like how much does your skin stretch? Does your thumb touch or nearly touch your wrist? Can you put your hands flat on the ground without bending your knees? So she ran me through the different Ehlers Danlos things, and I hadn't met enough of the criteria, so she diagnosed me with Ehlers Danlos type 3. There's different types, but Ehlers Danlos is a connective tissue disorder, and there's a lot of connective tissue in the body, and basically the connective tissue doesn't have enough structure, so it's too lax. So like the ligaments holding your joints in place, your blood vessels, a lot of things. And I was aware of Ehlers Danlos before, but I wasn't sure that I had it, because I do follow some people online that have it, and their like hypermobility from it is like very obvious. Like they bend at weird angles, and tend to have some severe issues. And I would consider my flexibility and hypermobility more mild compared to that, but it still meets the criteria. And then due to some of my symptoms, she also sort of suspected mast cell activation syndrome may be occurring, so she prescribed me a antihistamine called cipraheptadine that would also help with my appetite issues. And then she ordered a bunch of tests. So I had a bunch of blood work done, like 20 vials. I did a 24-hour urine histamine test. I then had a bunch of other tests back at that office, which is like an hour and a half away. So over the course of a month, I was there like 8 times, maybe? Something like that. But anyway, so the other tests are, I'm gonna have to read these off the list because I can't just recite these from memory. So there was a nerve conduction test, an audio and visual evoked potential, somatosensory evoked potential, a bike stress test, a QSART, which tests the nerves that control sweat, another tilt table test, but this time it measured the blood flow to my brain. I had on this like helmet device thing, and then a 24-hour Holter monitor, an EKG, and a celiac ultrasound. So that is why I'm tired. And then after all of that testing, I had my follow-up appointment, but this time it was with a different doctor who is the husband of the doctor I saw on the first visit. It's a husband and wife duo that work in tandem on patients. So this was my first time seeing him. And he also talked to me about POTS and Ehlers Danlos. And he was saying how because of the Ehlers Danlos connective tissue laxity, my blood vessels are not constricting enough to push my blood back up into my body and back to my heart and my brain. So like the second tilt table test showed that I had decreased blood flow to my brain when standing, which you know, that contributes to the brain fog that I experience. And what my body does to try to get the blood back up to my heart is release adrenaline, which causes me to live in like a constant state of fight or flight. So, you know, that's lovely. I've known for a long time that I live in that state and need to live a like low stress life. But the POTS Ehlers Danlos combo also causes me to have blood pooling in my hands and feet, which makes them cold, and they can look like mottled skin, and they might have some swelling. But the Ehlers Danlos is genetic and likely something that I've had for a very long time, and it kind of explains some things because for as long as I can remember, I have had cold feet and hands, and we've just always just had poor circulation, and like I've brought it up to doctors over the years, but nothing's ever been looked into about it. And I've also always bruised easily. I've been tested for anemia like at least 3 times, and it's always been fine. So now we know the cause of the bruises. But this doctor gave me 2 medications to try. One is called clonidine, I think. I don't know if I'm gonna butcher these names of medications or not, but I'm gonna call it clonidine. And that is supposed to reduce the adrenaline response, so I'm supposed to take it before bed because he's like, do you have nightmares and night sweats? And I'm like, yeah. Like I've always had nightmares and I pretty often have night sweats. He's like, are your nightmares scary? Yeah. Do they frighten you or like bother you? And I'm like, no. Like I've had them for a long time. Like you can't just keep being scared. I do sleep with the lights on because that helps me come out of my nightmares easier, because previously when I sleep in like complete darkness, it's like I wake up and I can't get out of the nightmare. So I guess I've adapted my way of sleeping a little bit, but hopefully that will help with sleep and restfulness. And then the other medication is, let me look, midodrine, is that right? And then the other medication is called midodrine, and I'm supposed to take that a few times a day, and it helps to constrict my blood vessels, so that forces the blood back up into my body, into my heart, to my brain, and it should help with the brain fog. So I am excited and apprehensive to try new medication, but you know, maybe it's gonna make me feel better. But I haven't started it just yet. I'm about to start it. And another symptom that I've had for at least since middle school, maybe even earlier, is sweating a lot. So I was diagnosed with hyperhidrosis in middle school, but it was never really looked into like a cause or other things that it might be related to. So I tend to sweat pretty easily, and that seems to possibly be from the releasing of the adrenaline. So it's kind of unsure how long I've been having symptoms, and just kind of thought they were normal because the only experience I have is in my body, and those things were sort of normal to me. But I guess they're not normal for everybody. And then at what point did the POTS start happening? And like, obviously I think the Ehlers Danlos and POTS, you know, were affecting me when I was sick with adenomyosis and made me so much sicker, because not everybody with adenomyosis gets like as thoroughly sick as I did. So I'm kind of unsure of when things for sure started. I just know there was a point when things got really, really, really bad. And then about the mast cell activation, the testing came back negative, but it's still not completely ruled out, so we'll see about that in the future. I'm still taking the antihistamine. I haven't really noticed a major difference with it. I think it maybe makes me have a little bit of a harder time waking up. But it's with mast cell activation, some people have rashes and itching and stuff like that, and I don't have that. It was maybe related to some GI issues that I was having. So I haven't seen a major difference, but it might be helping with my appetite, so I don't want to stop it yet. I don't know. We'll see how all this goes. And then I mentioned I had a celiac ultrasound. So it's the celiac artery, which supplies blood to the stomach and liver and spleen and some other organs. So it's important. And so I had an ultrasound on it and it was measuring how things were flowing through it. And it appears that mine is compressed and the flow is being restricted some. So I am scheduled to get a CT scan to further look into that for suspected MALS, which stands for, let me look, median arcuate ligament syndrome. But basically, because of the Ehlers Danlos and the laxity in tissue, there's a ligament along the celiac artery that is putting pressure on it and reducing the flow. So that's what they're going to look for. So we'll see if that's what's going on. But it is a comorbidity of Ehlers Danlos. And then the doctor evaluated my back and hip pain by pressing along my spine, and then he pushed between a couple vertebrae and he hit that pain spot. It lit up and he seemed to know what he was looking for. So he thinks that I might have a tethered cord, which is your spinal cord is connected, or I don't know. You can Google it because I don't think I can explain it that well right now, but that could be the source of my pain. So I'm getting an MRI to look at that, and then we'll see where all of that goes. So I think there was also some of my other tests that didn't come back normal, but we didn't address those in the appointment. I think he was trying to not overwhelm me with too much. We're dealing with the big issues now, the fatigue and pain, and then we'll look into other things, but it's a lot to tackle all at once. So I see him in a month and we're just gonna work and try to figure this thing out. All right, my brain is currently having some fog, but I think I covered the gist of what all has been going on. But although I'm tired, I am very happy to have finally found a doctor that is helping me find answers, and it is like a weight being lifted off my shoulders, because for so long I've had so much mental space taken up trying to find the right doctor, or feeling like I wasn't going to find the right doctor. So I'm tired, but I'm in the right place and the right hands. And I hope this video is a reminder that if you're struggling to find the right doctor and answers, that the right doctor does exist out there. They might be hard to find, but they exist, and it might take a few or maybe even several doctors before you get them, but it is so worth it to find the right doctor. Anyways, sometime after my next follow-up, I will update you guys about my new test results and how the medication has been working. So if you don't want to miss that update, be sure to subscribe. But seriously though, thank you so much for joining me on this crazy journey, and I hope to see you again soon in the next video. Bye!